Welcome back. In today's video, we're going to talk about the hips and the shoulder girdle. The primary functions for the hips and the shoulder girdle are movement. They are mobile joints. That is their primary function, and if they're not functioning in that way optimally, then you're going to see and feel dysfunction in the nearest joints. So for the hips, the nearest joints would be the knees or the lower back. And for the shoulders, it would be the neck and the lower back. Let's begin with the hips so that we understand a point of stability. Between the shoulders and the hips, we have a stable joint. That's the lumbar. And wrapping all the way around, we find our abdominal muscles. So when people are telling you to strengthen your core, it definitely does mean your abdominal chain, but you want to strengthen it from the inside out as opposed to doing a bunch of sit-ups that maybe make some surface area muscles a little bit stronger, but it doesn't make the actual entire core or lumbar joint more stable unless you fully understand that. So when we work through creating corrective exercise for, let's say, knee injury or knee issues, we're always going to look for the joints and for the correct use of each joint. Again, hips are a mobile joint. So what does that look like? At first, we want to understand that the hip socket is a ball socket joint. So the movement is going to be different than, let's say, for example, the knee joint, which is more of a hinge joint. And it's a stabilizing as a primary function of the knee. It is a stabilizing joint. So if we look at the hips as a more ball socket movement, we would want to optimize that function. Now notice what you do all day long. Are you sitting? Are you doing a repetitive movement pattern in one direction? These are things that we would look for to pretty much diagnose what's going on so that we can get you the right prescription for the exercise. So what does diagnose mean? It means using knowledge to actually look at what's going on, observe what's going on, and make a correct evaluation. That is what we practice here in diagnosing. We're not diagnosing disease. We are using our strengths of observation. And this is what we teach here, is so that you start to diagnose for yourself by uncovering what's going on at a root cause. With hips, when they've been stuck for a very long time, it's almost like a hinge or a screw, maybe a bolt that's tight and rusted on. And what do you have to do? Well, you have to oil it, right? Some people put some kind of spray on it, and this helps to loosen that up. Well, what we're going to do is do a little bit of that with your joint's favorite lubrication, and that is movement. So you say, well, wait a minute, if I can't move it, how am I going to move it to get it oiled? I'm going to show you by simply doing very small movements that you can pretty much start to do even if you're just doing a little bit. So if we were to move, keeping our pelvis, the lumbar, stable and strong as you can keep it, and we were just to take our heel of one side and press our heel into the floor like we were just going to squish out a little marshmallow. We're going to push into a marshmallow, and then we're going to rotate, and maybe we're going to tap. That starts a movement within the hip ball socket. It's pretty small, and I think mostly doable for most everyone. Okay, so then we shift and do the other side. Now, when we're shifting weight, we're being mindful that we are working to keep our stable, strong center so that from there we can do the mobilizing of the joint. And in our case right now, we're focused on that hip ball socket. So all we're doing is we're tapping or moving the toe out and in. And if you'll notice, my pelvis is not going anywhere. So if I were just to have this stable and then move the hip, we can create and increase the range of motion by, let's see if we can turn our toe in and turn our toe out. just by leaving the heel where it's at, and we're lifting the toe up and we're tapping inward or outward, and we're just keep moving that. That's almost like we're putting a little bit of lotion or oil on that joint. And the more you do it, oh, wow, it's a little bit better and it's moving a little bit better. So we can start out with that. Now we talk a lot about alignment. So this is another thing that's really important. So I just want to clarify that if you're not in alignment, everything's collapsed. We want to go ahead and get that pelvis into neutral. So the pubic bone and the pelvis bone are on the same plane before we start doing a lot of movement. Because if you're already out of alignment and then you try to do movement, it's actually going to aggravate the joint. So we want to be in good alignment, and then let's find our mobility. And that's the first part of creation of getting some lubrication to the joint of the hip. Now you can actually do that motion laying on the floor. You can do it laying from the side. You can do it even almost sitting, where you're just, now that you're aware that that hip ball socket can move in that way, you practice it in different positions, laying in the bed, standing, okay? And so really that's what we're all about here, is practicing these fundamentals on a regular basis so that you can restore for yourself that strength and mobility from the inside out. Okay, I'm going to show you one other hip movement that I'd like to try today, and that is our stork walk. So we're going to go ahead and put our hands on the pelvis, and that's where you're going to bring your awareness to stabilize. And then we're going to do that opening movement where we're shifting the toe open. And what we're going to do is we're going to activate the muscles of the glutes. The quads will get involved. Of course, the hip flexor as we bring that up. And we're going to bring that into what we call a stork walk. So we're going to open up the hip and we're going to bring it across. Now, if you can balance, then I would start to bring the foot one in front of the other if you're able to keep good balance. If that's a little bit of a struggle, go ahead and keep your feet hip distance apart so that you have more stability. So that movement, and we want to try to get 10 of them. So you're going to go forward and do the stork, and then we're going to reverse that and go backwards. So we're going to do the same exact movement, but we're just reversing it. So now it's coming up from the front first, and then it's opening, and you're going to really focus on the muscle doing the movement, not the joint. So the hip isn't actually doing the movement, it's the muscles around the joint. So our glutes are activated, quadriceps are activated, so muscles are turning on. All the muscles that move that leg are actively turning on. Some of them may be a little bit more dormant than others. When we tend to not use them, our brain is good at conserving energy and it will shut them off. But that's okay, because the more you do movements like this, and the more you practice being completely aware and present to your movements throughout the day, the more your brain will turn on more of those muscles and let them stay on instead of continuing to turn them off. So we just did a forward stork and we did a reverse stork. Now, there's lots of progressions to this, but I want you to just work on this for a bit and get your core really strong while you're doing this movement. And let's see if we can build up to 10. If that's easy, 15, all the way up to 30. And if you're doing that on a regular basis, just note whether or not that improves how your knees feel. So now let's go to the shoulders. The shoulders and the hips, I love to work together because this is where, in our current lifestyle, where we're often sedentary, mostly the shoulders get stuck in position and the hips get stuck in position. So the joints around them have to make up for that lack of mobility. So very simply, what we're going to do is we'll create stability from our center. And then all we're going to do is we're going to take our thumbs and reach them as if we have a tray on the table in front. And then the thumbs, we're going to reach and push them to the back while the shoulders are pocketed. So if you've seen my other videos We've talked about how the shoulders, shoulder blades specifically, they can protract, retract, elevate, and depress. Now, if they are constantly in a forward position here, we've seen many people with their shoulders forward, and if that's the case, then oftentimes those shoulder blades are displaced. So then a lot of the muscles are having to make up for the displacement of those shoulders. So we're out of alignment. So what we need to do is we need to restore where those shoulders are. And this is very common because I see a lot of folks who are doing exercises where they're in a forward motion, or they'll do lots of yoga moves that are forward when they're spending most of their day in a forward position at their desk, at their car. And this forward position actually needs countering. It needs the extension. And so this is what we're going to work on today, is creating an extension to help improve the retraction and actually where the scapula should be in a neutral position. So right now, a retraction from a forward fold might feel like this is all you can get. And all you can get is actually where almost normal should be for your scapula. But we want to get to the point where we can get the scapula to fully retract and be able to protract while we're in alignment. So we're going to work on that by taking the thumbs, facing them back. Imagine there's a tray in each of your hands. You have a good strong core, and the rest of your muscles are gently active. Nothing's dormant. You're not just hanging out. Everything's zipped up, good alignment and active. And we're going to focus our awareness on the scapula. So we're going to take the thumbs facing backward, and we're going to see if we can bring the scapula, so the little angel wings or the bones on your back, okay, we're going to try and bring them together, and we're going to lower them slightly down. That's all we're going to do. So we're going to retract, and then we're going to try to lower the scapula, the little shoulder blades, into our back pockets. Now, they may not move very much at all, and that's okay. So all we're doing is we are retracting and slight depression down. So we're going to retract and depress down. This should not feel strainy in any way. All we're doing is a retraction and depressing down, and a retraction and depress down. So that's similar to working on our hips, where we're just creating that gentle movement. So right now, all we're doing is we are working on getting the scapula to retract again, okay? So oftentimes I'll see folks like this, and when they're in this position, the thumbs don't like to open up. So even just opening the thumbs up and having the thumbs face back for that time, and then just doing this simple opening movement, a retraction through the scapula, can be a lot. So if that's already sensitive and you feel like, oh, I've done a lot of work already, okay, so good, take a break, and then you'll come back to this and we'll go to the next level, which will go into the actual circles. And I want to show something, because this is very common for folks who are on their computers a lot and using their hand. Most people use their right arm doing mouse work, and then their neck and shoulder starts to hurt a lot. So this is going to help that. And what we're going to do, excuse me there, probably just bumped the mic. So what I'd like to do now is show from this movement that we've just done a little bit of warming up, that we're retracting and depressing down. What that's doing is helping to reset alignment of the scapula. So you're retracting and you're depressing the scapula down. So right there, there's a lot happening in that movement. And once we've got that movement, I want to extend the arms. And we're going to start tiny little circles. So as we move circles, this is going to start creating that lubrication, if you will, for that joint. And so if there's any area of rustiness, this is going to help lubricate that joint. So we're just doing circles, and notice my thumbs are facing back, palms are face up. thumbs are facing back. And that's what we're going to do. We're going to keep those thumbs facing back. And notice I'm starting to bring my arms up, but my shoulders are not coming up to my ears. My shoulders are staying down. So we're facing back and we're doing tiny little circles, and we're still trying to drive the scapula down. Now, if you feel this going up into your neck, that should be a big red flag for you, because most likely you're using your neck to do the shoulders job. And the shoulders have a lot of muscles there, the trapezius muscles, the rhomboids, the latissimus dorsi, lots of muscles. And when those guys are not on, most people feel their neck being just miserable, because the neck's doing all the work to bring the arms up. So we need to turn those muscles back on, and we need to re-engage the brain to understand that the shoulder girdle is what we want to have be moving and using those muscles, as opposed to our neck. So as we float up, there's a point where we get up to about, usually it's about here for my clients, where they can barely get over the shoulder without feeling pain going up their neck. And I want to show you something. If you take your hand and you find a spot, there's going to be a very sensitive spot on your rib, on the side of your rib. And once you find that spot, I want you to press into it. Keep your arm out, but make sure you're out of your neck. Don't let the shoulder come up to your ear. Let the shoulder stay down, and hopefully you're now getting this idea. The scapula, keep that tip of the shoulder blade down in your back pocket and back. And as you press in there, what that's going to do is help release. So there's a pull pattern that can attach right here, serratus. And it's mostly anterior, but you may find it medial. That means in the middle part of your body and a little bit front. I rarely see it posterior, but you may. So you're going to find that sensitive spot. And once you do, taking a few deep breaths, we're going to do a windshield wiper with our hand. Just a little windshield wiper. And then we're going to turn the palm down and up. Just do a few movements. It doesn't have to be actually anything specific. We would just really need that movement to happen. And once you've done that, and you can feel the tenderness on that spot, and that tenderness is now going down, not because you've let go of it, but because we've just released a trigger point. And now you might find that your arm can move freely without pain. So without that pain, you now can do the movements a little bit more freely and get the movement patterns that we're going to be working on all through this week. Shoulders and hips. So the movements of the shoulders are different than moving from the back. Okay, so the shoulder girdle includes your scapula, and then the 12 vertebrae of the thoracic. And while the most primary function of the shoulder girdle is mobile, there are points of stability, always in any joint, but we really want to restore the mobility of that shoulder. And as you do, you'll start to discover and understand, oh, my shoulder does not mean my neck. And so when you reach for something, whether it's a glass or a file, or reach for anything, a hanger, you're not going to reach or fire the neck muscles. You're going to re-engage your scapula, all the muscles that move that scapula, because we've just lit those up in the brain. And now the function is that much better. Okay? That's corrective exercise. And when we do it properly and we translate it to our life and we practice it on a regular basis, practicing it just means that you're using it to lead your life. Okay? It doesn't have to be relegated to an office or the PT's office or some gym. It really needs to be something that you're doing on your own regularly to keep your body healthy. So I hope this helps. Please let me know if you tried it and how it went. If you're not subscribed to our social channels, please do. Remember, we always love answering your video questions, and if you post in the comments, let us know what your questions are regarding holistic health, nutrition, and corrective exercise. See you next time.